Okay, folks, here is Leo speaking, and today I'm gonna talk about the segment of the spinal cord, and also I wanna talk about the suicide of the spinal cord. Well, let me start doing a very rough sketch here, and what I'm gonna do first. I want to put the title of this presentation, that will be Neuroanatomy Part 3. No, let's do this. Neuroanatomy. Okay. Sometimes this pen works, sometimes doesn't. So let me just get another one. Okay. Neuro. Just a second. So I've been trying to keep the same font during my Sketchnote, so I also made this just to help me with to keep things let's say more organized. Neuro. Anatomy. Neuroanatomy. I might have to leave, but I hope to finish everything before the time that I have to leave. So neuroanatomy. Okay, this is the main topic of this presentation, and what I'm gonna talk is about the suicide, and I will also talk about the spinal segment. So let's start with the suicide. Okay, for the suicide, there is no other illustration better than this one to show you the structures that you're going to find on this segment of the spine. So I will not change the plane of this illustration, but eventually for other illustrations I will change and try to represent from another plane, just to change your point of view as well. But basically, when you go to the lectures, you will always see the structures in 3 planes. Can you guess the planes? I hope so, because it's supposed to be the most basic information that you get when you start learning about anatomy or clinical anatomy. Okay, so this part here is the posterior median sulcus. You need to visualize the first you need to identify which structure you were looking at. Then you are going to find the, okay, you are looking from superior, from inferior. What is facing to your body? Which part of this structure is facing to your body? Is this part the anterior? This part the posterior? So, okay, so what I'm gonna do here, I'm gonna add a few other things because it will help you to really identify if the structure that you are looking at is with the anterior face facing to you or the posterior part facing to your body. And here we have this part that is really important. Okay, I'm gonna talk about this part as well. First of all, this is the posterior part and this is the anterior part. Now, this part here is a sulcus, and we call this sulcus, actually this part here is the sulcus, and this part here we call the posterior median sulcus. Now, what I'm gonna do, I'm gonna label this part, maybe like this. And then I'm gonna write okay. Posterior. Let me know if you have a problem with the letter, capital letters, okay? I know some people don't like. Posterior. Posterior median sulcus. Posterior median sulcus. I'm gonna add the color here just to make this name here pop out and be more visible for you. The other part that we can label here is this one. This I'm gonna put the abbreviation of this part, which is posterior median septum, PMS. So let me just put here PMS. PMS, posterior median sulcus. Okay, if this is the posterior median sulcus, question: do you think that we have an anterior median sulcus? Actually, not posterior median sulcus, posterior median septum. Okay, do you think that we have the anterior median septum? Well, actually, we have the anterior median fissure. Okay, and this one is the deepest one here. So let me just put right here, anterior median fissure. And let me know if you want more videos of this per week. Right now, I just thought on 1 video per week. Anterior median fissure. Okay, we have the posterior median sulcus, posterior median septum, anterior median fissure. Okay, you have these 3 different parts here, and what I'm gonna do now, I'm gonna add the third one, this one, actually the fourth one, this one, quite simple. What I'm gonna do, I'm gonna label like this. This is the central canal. Okay, central canal. So we have these 4 structures already labeled here. Anything else that might be relevant? Well, we actually have 2 important structures here that are relevant for us. One is the posterior median sulcus, this one, actually posterolateral sulcus, this one, and the anterolateral sulcus, this one. Okay, so what I'm gonna do, I'm gonna do this thing here. This is the posterolateral sulcus, posterolateral sulcus, and then we have here approximately the anterolateral sulcus, or the, well, it is the anterolateral sulcus. Let me just put like this, because then we'll be clear. Anterolateral sulcus. Okay, we have on the posterior part of the spinal cord, we are going to find the posterior median sulcus and the posterior median septum. Then laterally to the posterior part, we are going to find the posterolateral sulcus. And then here in the center, you're going to find the central canal. Now, on the arterial aspect, you're going to find this fissure that is deepest, as you can see, and this is called the anterior median fissure. Okay, this is the first step. Then we have this structure here that looks like a butterfly, no? And this part here is the posterior horn of gray matter, and this one right here is the anterior horn of gray matter. How I'm going to label this? I'm going to label this one will be posterior horn, posterior horn of gray matter. Okay, gray matter. And this one is the anterior horn of gray matter. So let me just label here. Anterior horn of gray matter. What I highly recommend, guys, when you do the exams, don't use abbreviations. Try to use the full name. Leave the abbreviations as try to understand, of course, the abbreviation, but for your clinical practice. But you learn the full name of the structure. Okay, memorize the full name. Try to get used to the full name. In the beginning will be hard because there are so many names, so many structures to remember, but with practice everything will start to get easier. It will make part of your life. So be patient. Okay, this is something to, of course, when we are studying, it's quite hard actually, because you need to cover different topics in a short period of time, but don't give up. Try to be patient. Okay, it's the most important thing. Now this one is the white commissure. So let me just label white commissure. Okay. In the end I wrote with capital letter. Okay, let me finish this. White commissure. Well, I have here these are longitudinal grooves, okay, along the whole length of the spinal cord. And once you memorize this, you're going to notice that it will be easy to figure out the other parts of this structure. So before I carry on, because I don't think it's already 20 minutes, almost 20 minutes, I want to finish this video because I also have to do other things. What I'm gonna do, maybe the yellow one, because all the names are important in some way. What can I do? Let me just check something. Maybe what I'm gonna do, I'm gonna do this. This is a sketch note, okay? So when you learn, try to use this practice, especially if you are in this in the uni and you don't have too much time to take note of all the details that the lecture is presenting, or if you are in some participating from some workshop or some other congress, symposium. Just try to do the things as fast as you can. Leave the colors, or if you have a few colors, and not more than 2 or 3 colors, different colors. Try to keep always clean, visible. I'm gonna use the yellow here because I want to give emphasis to the topic that is neuroanatomy. It's not neurophysiology, it's just neuroanatomy. Okay, so we have this part here done. I can also add a few other details here, but I will leave this for something more personal that I'm gonna do later. What else I can put here? Well, I can also highlight with my pencil on the top of the letters. The advantage of using a pencil here, if I use a marker, I can probably have the risk of a mess with my note, because the marker can blend with the ink, the black ink, and it will make a mess. So just to remind you, posterior horn of gray matter, anterior horn of gray matter, posterior median septum, and then we have here the posterior median sulcus, which is this one. Okay, posterior median sulcus. I think that is more than enough. 25 minutes of video. Posterior, posterolateral, posterolateral sulcus, central canal, I will, okay, if you follow me till this point of the video, you can basically do the same thing that I've been doing here. But if you want to add more comments, try to use the rest of the page to add other comments. I will probably do a few other things here, add a few more information, and then, because actually the best way to study anatomy is just breaking parts. Don't put too much information in one structure. Try to redo as much as you can, and might be a bit annoying, to be honest, sometimes, because it is almost like draw the same thing many times, but I believe that it will help you as well, because you are in some way improving your visual memory, and in the end you are going to retain the information. This is the benefit of study like this. Okay, so I'm using this Pentel brush pen. Why I'm using the Pentel brush pen to paint? Actually, I could probably use the black color, black pencil, and would work perfectly. Well, I actually have a lot of cartridges that I bought. Just a second, guys. Yeah, thank you. I'm going downstairs. Cheers. Take care. I just have to, I literally have to finish the video now, guys. So what I'm gonna do, I'm gonna finish this part, and that's it. Thank you for watching. Follow me until this point of the video, and then I'm gonna do more of this. I'm gonna share more of this content for you. Let me know if you want more than one video per week, or just one per week is fine. Take care. Cheers.